All right. Good afternoon. Welcome, everyone. I'm Mikaela Schmitt. I'm a program manager of the U.S. Outreach team at the Pulitzer Center. I know this is a CUGH webinar, so I just wanted to introduce who Pulitzer Center is first. We are a nonprofit journalism and education organization dedicated to raising awareness of underreported global issues. Our mission is to champion the power of stories to make complex issues relevant and inspire action. Last year, we supported around 200 reporting projects in collaboration with over 300 journalists, filmmakers, and news outlets around the world. We also work with classrooms and communities to extend the impact of the journalism and cultivate public engagement with these issues globally. The Pulitzer Center's vision centers around building stronger communicators and more empathetic communicators from every background. We're excited to be continuing our longstanding partnership with CUGH for today's session. At CUGH's annual conference, we host a film festival as well as a communications workshop presented in partnership with Johns Hopkins Bloomberg School of Public Health and Global Health Now. We're already beginning our plans for next year's session, so we hope to see some of you in DC in April for CUGH's 2026 annual conference. And I'm going to share a blog in the chat here that summarizes some of last year's sessions, just in case you're curious. A few logistics before we begin our conversation. You'll see a Q&A icon on your screen. You can begin adding your questions for our speakers at any time throughout the opening discussion. Also, live transcription is available to be turned on with the captions icon at the bottom of your screen. I'm really excited to introduce our panelists for today's conversation. Knight Raskin is a freelance journalist who writes and produces for television, documentary films, and newspapers. Her producing credits include reports for PBS NewsHour and the investigative documentary program Frontline. Her documentary film credits include series for Netflix, National Geographic, and A&E. For PBS NewsHour, Raskin reported on Cuts and Consequences, the end of USAID, in collaboration with grantees William Brigham and Fred DeSam Lazaro. The project explores the impact of foreign aid freezes on global public health, with Raskin in particular investigating the immediate impact on several life-saving USAID programs in East and West Africa. GHOane Kavanaugh Simpson is a lecturer in the Master's in Science Writing program at Johns Hopkins University, a former staff member at the Miami Herald, and a freelance journalist whose work has appeared in the Washington Post, USA Today, Baltimore Sun, Scientific American, and on WYPR, among other outlets. A previous Pulitzer Center grantee, she also served as the inaugural special advisor to the Pulitzer Center's AI Accountability Network. With Brian W. Simpson, they reported for NPR on innovative responses from health workers in Uganda who are struggling in the wake of chaotic cuts to U.S. government aid. And Brian W. Simpson is editor-in-chief of the news websites and daily newsletter Global Health Now, and a lecturer in the Master's in Science Writing program at Johns Hopkins University. His work on U.S. and global public health issues has appeared on NPR, Smithsonian, and the Baltimore Sun, among other outlets. So thank you so much for joining us today, and thank you so much to our panelists. I'm going to hand it over to Brian to get our conversation started for us today.
Great. Thanks so much, Mikaela. It's really great to be working with you, the Pulitzer Center, and CUGH again. It's always a great opportunity. So let's go. I'm going to go right away to hear about the projects, and I think Molly, we'll go ahead and start with you if you like to tell
Sure.
us about your project, and then we'll go on to the one that GHOane and I worked on.
Sure. Well, thank you, and thanks to you all for being on this chat today. I really think this is a wonderful opportunity, so it's a pleasure to be here. So, as Mikaela just mentioned, I worked on a project with the support of the Pulitzer Center for the NewsHour with my couple of my colleagues there on the aftermath of the cuts to several critical life-saving programs in both East and West Africa. Probably like a lot of journalists, there was a bit of a scramble after we first heard about the cuts. It was such a massive decision with such far-ranging implications that it took us about 2 months to decide where we would go in the world. Of course, USAID had a presence in, over 130 countries, and also to decide where we could go, where we could actually see the immediate impact of not the cuts in general, but more, we were looking at the way in which the programs were cut, which was so abruptly without any notice, and and frankly, with a lot of chaos surrounding the decisions for people who are in the field operating on these programs. So that was our goal, was again not to kind of look at the bigger story of foreign aid, but to look at again the way the cuts were carried out and whether or not people had died as a result of the cuts, and also sort of look at what people on the ground were saying might be the long-term implications of the cuts. So we went to both Ghana and Kenya, so East and West Africa. We made that decision pretty easily because outside of Ukraine, the continent of Africa received the most American aid. And we chose two countries, Ghana and Kenya. A lot of that was frankly logistical. I mean, USAID had a huge presence in so many countries in Africa, but we chose Ghana mainly because even though it is a democracy and a stable country where they're working really hard to build up their own pretty fragile healthcare system, USAID had a very large presence in the north of the country, which was really interesting to us because it's very different from Accra, the capital, and its surroundings, and because it borders a region with so much instability. There's a lot of growth of terrorism and extremist networks in the Sahel. So we went to northern Ghana, which is on the border of Burkina Faso and Niger, and that region has seen, a lot of the threat of terrorism. And what we found was, in addition to the fact that the health programs there were already starting to crumble, that despite the U.S. promise to continue life-saving programs, it was a very incoherent policy in those early days. The drugs were sort of getting there, but in a lot of cases they weren't. In a lot of cases, clinics that relied on U.S. support were getting, half the medicine that they usually got, so they couldn't fulfill, again, life-saving distribution of drugs for their patients. And we also found, on the sort of soft power security side, a lot of fear that the US pulling out would leave an opening for bad actors in that region. And in Kenya, we looked at the PEPFAR program, which I think, a lot of you probably have a lot to say about that. But as you all know, the US government has promised to continue PEPFAR. Various numbers have been given by the administration, I believe somewhere in the 80% range. When we visited Kenya in April, what we found was that while we were continuing the supply of drugs, medication, and some other support, we had cut all of the funding for sort of the ecosystem that supported PEPFAR. So even though the drugs may have been there in the warehouse or at the clinics, patients were still having a really hard time figuring out what was going on or accessing those drugs. So there was a lot of fear at that time. Again, this was a couple of months ago now, that HIV rates, AIDS rates would go up dramatically in that region in the next months and years. And so those are the two reports we did. And since then, I've been just continuing to report with my network of sources from all over the world and figuring out where to go next, hopefully. So thank you.
Fantastic. We're going to go next to Ridwan Karim Dini-Osman. But Mikaela, I think you want to start off with his introduction.
Yeah, I just wanted to jump in real quick and share a quick bio to introduce our final panelist. So glad you're able to join us. So Ridwan is a senior reporter and news presenter at the EIB Network, and he's a freelance correspondent for the international radio news program The World. He is also currently a Nieman Fellow at Harvard University. He reported on how shrinking U.S. foreign aid and global funding cuts are impacting Ghana's ability to respond to outbreaks, with health experts warning of long-term consequences for disease prevention and research. So do you want to share a little bit more in depth about your reporting and what you found?
Yes, thank you so much, Mikaela, and thanks everybody. So I did report on meningitis outbreak earlier in the year, but subsequently I also did something about malaria research, which has also been adversely impacted by the cats. But I would start with the meningitis outbreak, which, happens every year, but the one that happened this year was very unique because it was a different strain of meningitis, which meant that the existing vaccines could not protect people against the disease. And also, it happened at the time that the cats had kicked in, and the government had indicated that the withdrawal had created a deficit of over $156 million. So I go into the northern part of the country, which is like the epicenter of the outbreak, and you know, there are no resources for the health workers to effectively respond to the outbreak. Some of the people that were, going through trainings that were being supported by USAID, those trainings had halted, and those people could have been part of the response. We were also at places where, for instance, oxygen supply had been curtailed. And also remember the northern part of the country is an area that has been traditionally marginalized, which meant that there's been underinvestment, there's lack of political attention, and a lot of the people in the area live on less than $2 a day. And so people cannot afford health care. There are so many people that are not on health insurance, and these things are happening. And, the government is unable to respond because, the budget is under a lot of pressure. And so that was the situation with the meningitis. Then I also come back to Accra and I speak to scientists about, how to contain this particular outbreak. And they are saying that, well, we need to modify the existing vaccine, or we need a whole new vaccine to be able to tackle this. But the challenge is that we cannot, even proceed with the discussions and even how to put this study together because the funding has been withdrawn. And also we know that the US and its withdrawal was contributing about 18% of the budget of the World Health Organization, and so I spoke to a representative from the World Health Organization who indicated, some of these challenges. Then subsequently, before I came here at Cambridge to begin my fellowship program, I did another reporting focusing on malaria research. We know that malaria is one of the biggest killers of young children in Africa. Every year, over 600,000 people die, and nearly almost all those who die every year are from Africa. And so I wanted to understand, how the cats have impacted researchers. And there were so many, research works that have been halted because the funding simply has been withdrawn. There were some interesting research works that were supposed to have started, and the scientists had put together the proposal. They sent it to the US, and the approval was going to be given. And then they hear that, what, everything is on hold. And now this game-changing research that would have, done a lot for the continent is in limbo. And these scientists simply don't know what they are doing, and apart from the research, there are also other partnerships that were really helping in tackling the disease. All those partnerships have been halted. And I'm not talking just about Ghana, but across the continent, in places like Ethiopia, the situation is dire, and I had the opportunity to speak to some scientists at Johns Hopkins, and, they tell you that there's a lot happening on the ground that is really, really concerning.
Thank you so much, Ridwan. That's yeah, a great big picture view for us today. I'm going to go next to Joanne Kavanagh Simpson, who will talk about our research in Uganda. And full disclosure, we are married.
People eventually figure they're like, we have the same last name.
Joanne, you're on mute.
Oh, I thought
Okay, we can hear you now.
Yeah, I'm not on mute. Okay. We were at the CUGH conference in Atlanta this spring. This was in March, I believe, just basically weeks and months after everything started to happen. And there was a lot of concern and worry, and also a lot of resilience and hope that we were seeing already emerging. And one country that kept coming up in the different panelists and presentations was Uganda. And there's a quote I have from the president of Afra Health that inspired us in our project, and is, "We need to share our expertise and knowledge. We're in a global village. What happens in a small part of Africa escalates to the other parts of the world." So we started with that, and then our project, we wanted to aim about 6 months out to where some of this was starting to, some of the shock will never probably wear off. But the initial shock was wearing off to where people were starting to figure, okay, what do we do now? And to look at possible adaptations, filling in the gaps, to quantify some of the losses. So we we also wanted to make a difference ourselves as journalists and to make that difference with knowledge. So we went out to Uganda for a few weeks this summer and talked to dozens and dozens of people. And what we found was there were some, of course, essential losses. One of the groups that we found most affected, well, first of all, women in general in so many areas. That's a lot of what we're writing about in our next couple stories as well, is sex workers. It's really the sex workers and what they call key populations, mostly LGBTQ communities. And in these cases, the PrEP, prophylaxis for HIV had been cut, and even though it came back in the emergency, the emergency agreement for pregnant mothers and some other individuals, sex workers did not qualify. Condoms that would come to the brothel where we visited, they would get there's local NGO would help them get 9,000 condoms a month. And so I can talk a little bit more about the case of the woman we spoke with. But we found with those losses, we found people still in there trying to help, trying to find answers. We found a range of healthcare adaptations from, we talked to a local government official whose staff of 350 was cut by 100. And then the HIV specific clinics are being shifted to hospitals, and sort of what their struggles were to try to serve their patients. Now, of course, these are already overburdened hospitals and small clinics, and there's bias still against people with HIV within. So that's among nurses, nursing staff, medical staff, and patients, et cetera. So everything was sort of a struggle. They're just sort of moving forward. And then we spent a lot of time too, which is one way we're shifting now to local small operations, either NGOs or nonprofits or private health systems. Some of them are faith-based, some of them aren't. And from things like this place called Soft Power, where they gave out tens of thousands of mosquito netting, because obviously malaria is being affected. They charge very small rates for fee-based care, which is an approach. And from there to basically what I also started going into, which were innovations. One thing, because my background is write about technology, science, technology, and AI, I wanted to see how technology was coming into play. The ideas of AI, not often in an African narrative, at least outside of Africa. It's very big to talk about within, local, regional news organizations to cover. There's a lot of AI research going on. But I wanted to see how technology was playing in as well. And I'm going to let Brian talk about one of them in terms of pharmaceuticals. But what we found there too was a range from basically one thing that's called smart triage, which is a app-based algorithm which helps determine sepsis risk. Children will come into hospitals and they'll have pre-sepsis, and it mimics a lot of other illnesses. So within 2 hours, they might die because no one is seeing that they have a sepsis, that they're basically going into sepsis. The rooms are overcrowded. There's just a lot going on. And sometimes it's caught, sometimes it's not. So they started with this algorithm that they're testing, and this is going well. Now, this is funded locally. It's funded by Canadian, the University in Canada and the Canadian government. That one's going forward. Another project was an NIH grant, multi-million-dollar NIH grant on using machine learning to determine whether a lung mass, a very complicated lung cancer, they're often very advanced by the time they get to a doctor, was TB or cancer. It's really difficult to tell. So trying to use machine learning. Well, they're just kind of halfway through, not even that, the project, and all those grants have been cut. So, what I'm finding too, because we're also just looking at what's happening with with general illnesses of, cancer and everything. It affects every part of the medical system right now, what's going on. So with that, I wanted to switch it over to Brian to talk a little bit about those adaptations too and resilience that we saw and drawbacks.
Absolutely. Yes. Thanks, Joanne. One of the things that really struck us was the resilience that we saw amongst the leaders and public health practitioners, scientists across the board in Uganda. And just one highlight to share with you, we met with Paul Mwanje, who is a director at the St. Francis Healthcare Services in Njiru, Uganda. And he had a unique perspective on the U.S. cuts because he had been through it before. In 2014, there was a pretty strong PEPFAR cut in Uganda, and his organization was forced to lay off 18 of its 48 employees. And he told us that, and this is a quote, "It was an eye-opener to us then that this could happen. But that experience made them realize just how much they were dependent on a single foreign donor." And so what they did, after that experience was they worked really hard to seek out more private donors. They've increased their revenue by doing new surgery, new procedures and services like surgery, radiology, and dental exams. And so that was one example. And another that Joanne alluded to is a African-owned pharmaceutical company called Quality Chemical Industries Limited. And they produce antiretrovirals, medications for malaria, hepatitis, and other illnesses for Uganda and 13 other African nations. And they do have plans to produce lenacapavir. And their factory there is in Kampala is set to increase production by from 1.4 billion tablets annually to 2.4 billion within the next couple of years. And this spoke to us because these are stories that aren't always kind of out there that we did pick up on in terms of the resilience. And one last quote, another from Dr. Rhoda Wanyenze, who's Dean of the School of Public Health at Mikaela University. And she emphasized that in the future, if the U.S. comes back in the future in a larger way, that the collaborations should be different and they should be based on country ownership. And she told us that leadership of programs right from inception, conceptualizing how they happen, including how they end, which was a kind of a powerful note for us to end on too. So we'll go ahead and wrap up that section now for us. And I want to go ahead and move into to do a couple quick polls. We'd love to hear from you. We've got a lot of people on listening in today. And so I've just launched a poll. And the first one is to have you or someone you know lost a U.S. government grant? So please let us know that.
The answers are anonymous.
And the answers are anonymous. Thank you. And there's a second question there. What's your biggest concern in global health over the next year? So we'll give you a minute here to register your thoughts. We'd love to hear from you and give us on the panel a chance to read the room and see where people are coming from. So we'll give this just a little bit more time. Please go ahead and put your thoughts in. And just so everybody knows, we'll do a kind of a quick reveal of this first poll, and then Mikaela has graciously taken on the challenge of creating some themes from the second question on the short answers. So she'll be reporting back to us in just a little bit. So love to have your inclusion here. And it looks like people are still signing on and still adding to this. And while we give you just another few 20 seconds or so, Keith, I didn't know if you wanted to say hi to everybody here. Keith Martin, head of CUGH.
Oh, thank you very much, Brian. It's lovely to see everybody. Mikaela, Brian, Joanne, thank you so much for leading this effort. And to Molly, Ridwan, Joanne, thank you very much for being panelists on this. For us at CUGH and Brian, Dana, Mikaela, and the team at Pulitzer, we're really honored to work with them because one of the vexing challenges that we have, and we really appreciate as we go through this, your advice to the audience, is how can we communicate in this fractured environment? We know we have to appeal to the coconut, but we also have to appeal to the heart, right? All of you are experts as speakers and telling the stories that move people and policymakers. We would really be grateful as you go through this to share your advice as to how are the folks on this particular that are attending this session, but also there are 36,000 people around the world who are going to receive this in 2 weeks' time, what they can take away so they can learn how to do this, how they can be better communicators and actually communicate for impact. So this is a process. Our hidden goal, which I will tell you about right now, is to create an army of public scientists. So don't tell anybody, okay? The public scientists. We want people to be powerful advocates for science and people, places, persons, and issues. And thank you very much again from all of us at CUGH for helping us in that effort as you continue to do, and for all of you who are here as folks on the sessions. Thank you very much. Thank you, Brian. Thank you, Mikaela. Back to you.
Absolutely. Thank you, Keith. Appreciate that. And we're going to share the results from the poll, which I did not expect. This answer to the first one, have you or someone you know lost a U.S. government grant? It looks like 75%, 3 out of 4 people said yes to this question, which is kind of astounding. And so that's another sort of metric for us all to be thinking about in terms of the reach and impact of these cuts. So I'm going to move along really quickly now. And give you sort of like an introduction in terms of like a big picture view. I know a lot of this may already be familiar with you. And thank you, Mikaela, for sharing the screen here. But as we all know, in January 2025, the U.S. government cuts for foreign assistance began rolling out, and they hit with unprecedented speed and impact. USAID, which had been credited with saving more than 92 million lives over multiple decades, was dismantled. Other programs were shuttered or reduced, including at the U.S. National Institutes of Health, the Centers for Disease Control and Prevention, and beyond. And these data points that you're seeing now reverberated. These show that the cuts really reverberated and continue to reverberate through multiple programs in multiple countries. And it's worth noting that the US is not the only country to make cuts to foreign assistance for health. The UK, France, Germany, and others have been cutting back as well. So even with these estimates and projections, it's still very difficult to get a handle on what's really happening at the city level, what's happening at the clinic level, and most importantly, what's happening at the human level. So that task, as you've heard from my fellow panelists here already, that task falls to journalists. So we'll start with about 15 to 20 minutes of discussion and then invite you to share your questions. And in the second part of our program, we're going to be talking about communicating science and how you can work with journalists to share your scientific findings with the public. So let's move on to the panel discussion. And we'll get started on that right now. So again, I want to welcome the panelists and thank you very much for participating. And I'd like to start off by asking you each to tell a story of an individual that gives us an idea of what's happening on the ground and the real impacts of policy decisions. And Ridwan, would you like to start off?
Absolutely. I would like to talk about the one on malaria, which is my recent reporting. One of the scientists I spoke to at the University of Ghana was doing a research on identifying certain plant species that when mosquitoes, suck on the juices of those plants could actually help eliminate or control the mosquitoes. And that was the research that he planned on undertaking. And he's done he's put a lot of preparation into that work, hoping that, when this goes through and they are able to do it successfully, it would change the trajectory in terms of malaria control and elimination on the continent. And then he receives an email, somewhere in the year that we are sorry, you cannot proceed because this is the situation and there is nothing, we can do about it. And so back in Accra, the work cannot continue. And you also go to a lot of the rural areas where these rural folk are receiving mosquito nets. They are not getting them anymore. People that were going to community, providing critical, information about malaria, about HIV, all those, activities have been halted because a lot of them were being funded by USAID. And the situation is also particularly dire. I remember when the news broke, and this one wasn't by the Pulitzer Center, but when the news broke about the dismantling of USAID, I did a story from an orphanage for kids living with HIV, and you could see the desperation from the founder of the orphanage, wondering what the future of these kids is going to look like without access to life-saving medication. So these are the issues that we are looking at. I remember interviewing somebody from South Africa. She manages an NGO, where people, I mean, places that they used to go and get these life-saving medication and these services, they've gone to the place and it's under lock and key, and nobody is giving them answers. People who are supposed to provide certain services are getting emails that, we cannot proceed, and they are not getting any explanations why the work cannot go on, or why they can't do the work anymore. So these are the realities on the continent, and this is what I can share from where I sit.
That's great. Thank you, Ridwan. Appreciate that. Molly, would you like to share your individual story?
It's difficult because there are so many. And I have to say that, when you're in the field reporting these stories, they become so personal. It's really hard to pick one, unfortunately. I think the one I would like to share is actually about a group of young women in Mombasa, Kenya. As I mentioned before, we went to Kenya to do a story about PEPFAR. At the time, and I believe still now, the administration's newly formed Bureau of Foreign Aid under the State Department said and has continued to say that they'll continue to support PEPFAR, again, giving various numbers or degrees of support. What we found on the ground in Kenya, in particular with this group of young women, to me really illustrated the challenge going forward of this new approach, if you will, to PEPFAR, or the reduced support for PEPFAR. In Kenya, which has had a lot of success combating HIV/AIDS over the past, decade, and was really on track. The idea of all of these programs is eventually self-reliance, and that may have been further off for some programs or some countries than others. But again, in Kenya, there had been so much and such tremendous progress made combating HIV and AIDS. And what we found while we were there was that a lot of that progress was due, of course, the medication's important, and there's so many breakthroughs now, of course, with the new vaccinations, and that's critical. But also critical to controlling global HIV is, again, this ecosystem I was talking about earlier, which is the community support. The one thing I think it's important that we talk about today, and I think we will touch on, is the data, that has been erased. Community health workers were the ones, certainly in that eastern region of Kenya, who are going out and getting the numbers. People who are living in dire poverty do not have time to walk to a clinic and self-report their viral loads. So there were these really incredible kind of warriors that we met all over the country who were doing this work, and we're really proud of it, going into communities that were struggling, where people are, either unemployed and very ill, or they're working, 2 to 3 jobs to keep their children in school. And so we met a lot of families again who weren't able to get their medication because previously with PEPFAR and the funding to the HIV programs there had been a support system that would give them either just a little bit of financial support in some way for their small business, so they would then have the money to take the bus to get the medication, et cetera. And so there really is this whole support system that made PEPFAR successful. The group of women I just wanted to touch on, because I found this particularly tragic in Kenya, was a program called Dreams. And it's a big part of PEPFAR. It's in many countries all over the world. I'm not exactly sure how many. But in Kenya, they were really grappling, when I say they, but all of the programs that received USAID funding, PEPFAR funding, were really grappling with the fact that the administration kept like a large number of PEPFAR programs and then inexplicably cut huge programs for tens of thousands of people. So in this case, in Mombasa and Kilifi next door, an entire program serving, I think tens of thousands of OVCs, orphans and vulnerable children, and also adolescent young women had been completely cut. So we met and they had sent, cables and pled with the administration, et cetera, to no avail. So what I wanted to just say was we'd met a young group of women who were enrolled in this Dreams program. The idea of Dreams is that one of the fastest growing populations vulnerable to HIV are young women, particularly those who are forced to engage in sex work to make a living. And in this part of Mombasa, there was a community where that had been a real problem. And these young women had been receiving support from PEPFAR, very simple support, but to live in a shelter that kept them safe in an area where there's a lot of violent crime against women. And also to provide them with reproductive education and also birth control, condoms. And that was all gone. So we met with about 20 young women in their teens and early 20s, all of whom were victims of sexual violence. And they had lost, because of the PEPFAR funding, not only regular access to their medication, but also access to all of the preventative work in the community. And so I think this to me is something to really look at going forward is, maybe again, in your work as scientists, it's really hard as a journalist, we could talk more about this, but to document something that's already gone. And I think that's our challenge going forward is that a lot of these programs have just disappeared. And with them, some of the data has disappeared and people have left, the clinics have closed, et cetera. And so how do we go out and actually see something that's not there? And how do we, for example, compare? And I think it will be up to, the best scientists, all of your work to go out and look at, like, for example, two communities side by side, one that lost all of its funding and one that kept some, and what happens in both. And I think that will be extremely telling going forward and also like really important work. So just wanted to share that because these young women, when we left, they had lost not only like the health and security, but also their hope. And that was pretty hard to see.
Yeah. Yeah. No, thank you, Molly. It's a definite challenge there in that kind of reporting. Joanne, I wanted to hear from you.
So we went out on, in the field quite a bit, and one place we went was a brothel, something I did not recognize as a brothel because it was different than what I would have imagined. It was just a long concrete space with some doorways and behind a bar, and this is what many of the brothels along the main highway in Uganda look like. And sat down and spoke with a young woman, 25, who had ended up at the brothel. She's among those who are there because of lack of opportunities, poverty. Some are trafficked into these situations. And what she had to say, her hopes and dreams were really moving. Like she wanted to save enough money to, open her own chicken farm. There were a couple of chickens she was taking care of at the brothel. And she had a small son who was living with her mother, and she sent all her money practically back home. She could only go home once a year to see him. And, she talked about what it was like to have to service these men, many per night, every day. And now she doesn't have the protection that she had before. The 9,000 condoms are no longer there, and for all of the women who were there for that month, and she's one of, like I said, 130,000. And what I found in her story and others is that women suffer the most in many of these cases. Many of these women who aren't getting services are single mothers, are mothers of multiple children, are victims of domestic abuse, are, I mean, not that men aren't going through many of these things as well. And a question was that Brian actually asked this question. What do you do when you don't have What do you do? What do you say when the man won't use one? And she replied, now when we don't have condoms, we just give in. And we presented this. We're probably going to speak about talking to audiences who may not be as global health oriented, maybe more conservative. We presented this story and our findings to a Rotary Club. Now, Rotary Club has supported polio. It's not that they haven't supported, polio treatments and prevention and vaccines, et cetera. But we were told ahead of time it was a mostly conservative crowd. And so that was good going in. We knew different ways of approaching this to show the people's stories, to reach out to essentially, I'll just say this: a lot of the Ugandans we talked to was so we know Americans don't always want to pay taxes for us. We don't like taxes either. So of course we brought that up in the discussion. That would click with this particular audience. And at the end, one gentleman asked me, well, why does Uganda have prostitution be legal? Why is prostitution legal in Uganda? And I said, well, prostitution is not legal in Uganda. The women are often brought in on lower charges, and that there's a lot of factors in the situation that create prostitution. And I said, prostitution isn't legal in the US either, but we still have prostitution. And he nodded his head. And afterward, we just got a lot of good feedback that we had just basically laid out human stories, laid out that it was the shock that was the trouble, that most of the trouble came initially from this unbelievable shock of the loss, and that people were trying to work things out. And I think people came out with more respect. So using those stories to communicate, I think are very effective, even among communities that might not already agree with what we're doing or saying.
Great. Thank you, GHOne. Yeah, absolutely. The power of stories and then the power of individual stories, of real stories, is definitely one of the huge powers of journalism, and that and data as well. So you shared that this one brothel got 9,000 condoms delivered every month to them, and it was by St. Francis. But this was USAID funded, supplies, or USAID supplies the condoms, 9,000 per month, and now no longer there. And that was one of the most, I think, one of the most telling data points that we came across too. So Molly, you talked a little bit about the difficulty of reporting on this story, and I'd love to hear maybe from Ridwan. Can you tell us a little bit about the challenges of reporting on a story that is so global, so nebulous in a lot of ways? How did you approach it? How did you succeed in reporting on something so difficult?
The difficulties are many. I mean, for instance, at some point I wanted to get in touch with people who are either working or had just recently, been laid off as a result of the withdrawal. And a lot of people were not willing to talk to me. The other challenge is that a lot of the communities that I report on are hard to reach areas, and sometimes they are understanding and appreciation of some of these issues is a bit complicated. And so you need to go through like multiple layers of, contacts and, sources to be able to get through to them. But I also, and a lot of the time people say that Yeah, but I mean, what are your own government, doing about it? And I think that's what on the even on the ground, talking to people, I even the local folks they kept asking me, I mean, why is the government not stepping in? Why is the government not addressing this? But I think it was also very hard explaining to people that even before these withdrawals were announced, Africa takes about 25% of the global disease burden, yet its share of the global healthcare expenditure is less than 1%. So the situation was already dire before these withdrawals started. And also, a lot of these diseases that we are seeing on the continent, whether it is malaria, whether it is meningitis, they have become worse because of climate change. And we know it. And we also know that the continent is disproportionately affected by climate change, something that it has very little to do with. When it comes to, global carbon emissions, US and China have the biggest license, yet we are bearing the brunt. And also, let's take a look at how this whole cuts were done. Very abrupt. Countries had very little time, to prepare for these, impacts. And so it was really challenging trying to explain some of these, geopolitical issues to people, and also generally like the cultural setups in some of these communities and the understanding of some of these things. So, for instance, there were places that people thought meningitis were spiritual. Meningitis cases were spiritual. And so instead of going to hospital, they rather spent more time at with traditional healers or in prayer camps. But I guess like these are isolated cases. But like getting people to appreciate the global context of what we are currently grappling with was extremely hard.
Mhm. Great. Joanne, I think you had some thoughts on sort of the challenge of scientists who were afraid to talk. Would you like to talk about that?
Yeah, and this was actually, we ran into that mostly in the AI area of all things. You think AI would not be, controversial, but there's still grants. And so one individual we spoke with, we spent an hour with him, and then afterward, he's like, "Is this anonymous, or are you going to use anything?" And, as a journalist, that's the last thing you want to hear. We'd already got we had the contact that connected. We said what we were working on. We got his name spelled, and so we didn't use his project as a result. Whereas we might have been able to work something out if I think when working with someone who's concerned, and I know Molly can also speak to this, it's very helpful to let them know that we always let them know that no matter what we were writing, we would make sure they knew exactly what was going to go into the story. So we would check with them on facts. We didn't say check for approval, but check on facts. So they would be no surprises. So it was transparency. If they really didn't want to talk by name, then there are different. I'll put in the chat a little bit. There are different rules with journalists in terms of what you're supposed to do in terms of ethics, and one of them is how you communicate with your sources. And so we'd ask, well, can we talk about this on background so that we can use this information elsewhere, not attributed to you? There are a couple different levels of this, but what they want to know is, am I going to be in trouble? That's what they care about more than anything. And so it's negotiation. And in his case, I think we were just, we had a lot of material already. And frankly, he just missed a chance to get some attention to his project that we could have done in a way that wouldn't have gotten him in trouble, because we just had other people by that point. So I wouldn't recommend doing that. Don't at the end say, you can't use this. Try to, if the person's being straight up, he pretty much knew what we were doing. I don't know what, maybe he got, nervous at the end. But there are rules for that. So if you say things like, this is off the record to the journalist, that means I can't quote you. I can't use anything you're saying. I can't, this information can't even be used if checked elsewhere. So off the record isn't really the phrase that works with journalists. Not for quotation works. on background works. So having those negotiations, and I'll put a Society of Professional Journalists list of these in the chat. So I think everyone wants to get our information out there. Even journalists don't want to, right now, don't want to necessarily raise the wrong kind of hackles if you can help it. At the same time, you have to have courage. You can't be censored. I mean, we're all trying to figure out how to work in this paradigm. And I think we had one other who was just a young student who was getting his visa, and he was counting down the days to his visa to get in the US. And we're like, no, don't worry. We're not gonna run anything with your name, certainly before you leave. And then we didn't end up using him, but we might have gone back to him after he came to the US and said, wow, you made this really great point. We love your work. Do you feel comfortable now talking about it? Because the work he was doing himself was very impressive. So that we may be able to talk about that and there would be no bearing on his grants or anything he'd have to worry about. So that kind of communication.
Great. All right. Thank you. Okay. Well, I want to kind of move on, and just a couple of notes for the panelists here. If I ask a question you'd like to answer, please just give me the sign here, high tech wave. And then also too, if we can, I'm just noticing we're running a little bit behind time, and we have a lot to cover. So if we could keep our answers short, that would be awesome. I'll go ahead and ask this question too, because it came up in a discussion yesterday. About holding off preconceptions. As a journalist going into a situation, it's kind of hard not to have an opinion about it before you even get there. And Molly, you had talked about this. Would you like to sort of address that?
Sure. I think that's an important one. So unfortunately, global health has suddenly become, political, in a way that it hasn't been before. And I think the challenge for us as journalists is that, I think a lot of people that I tried to reach out to or sources were thinking, okay, she just wants a story about how USAID leaving is so bad and how, the administration has done something awful. And so I think it's really incumbent on us as journalists to convey the fact that the stories the stories that I wanted to do and that everybody here is working on are about the impact on communities globally, and not again engaging in what I wanted to do was get out on the ground, talk to people in communities, but get as far away from the sort of like vitriolic political debate and even frankly, the vast numbers, the projections of deaths, those are so important. They'll be so important going forward. But right now, I think people need to really try and look at this objectively, because I think, the cuts to aid do raise a lot of questions about what we were doing and how we were doing it and how countries give aid and how reliant some countries had become and how destructive that can be when that donor goes away. So I guess what I would just say about that is that it's important, however, all of us can going forward, to not make this story political, because you're going to alienate, a good portion of your audience, no matter who you are, And so I think really, again, trying to be, if you will, as scientific as possible about how we approach the storytelling. How do we say, if this happens, then this happens? And it's fact-based. It's no different than anything else that we're doing. These are not opinion pieces. These are fact. We want to see what is happening because of these cuts to global health, And so I think that's something really important going forward, is for us to challenge our own assumptions about aid, and also for people on the other side of the story to sort of open their minds to the fact that, this is a good time to like examine all sides of foreign aid and certainly like global health support.
Terrific. Thank you. I've got one more question for you for this section. Before we get to kind of a revamp of a recap of the poll number 2 results, and then moving on to the audience Q&A as well too. So don't worry, folks, you're going to get your questions in. So last question here for this section. Moving forward, what solutions do you see out there? and I will kind of leave it up to you. Anybody want to take that one on first?
I think that this whole situation, I agree completely, should serve as a wake-up call to particularly African leaders. Because over 2 decades ago, they committed to what is called the Abuja Declaration, which says that each country was going to commit 15% of its budget to healthcare. A lot of countries have not realized, this. And I feel that it is about time we took issues around health very seriously because it affects everything, and so I think that commitment, we need to go back to the Abuja Declaration and see how we can commit more resources in the area of healthcare and science. Then the other thing is that I also think it is time for the private sector to reassess where their corporate social responsibility, initiatives are going to. If they are doing more on arts and culture, maybe it is time to now focus more on health. And a lot of these scientists are betting on the support of, the private sector to be able to fill the gaps that have been created by these cuts. So I think these are some of the immediate thoughts I can share.
Awesome. Great. Thanks. And GHOne, yes, go ahead.
One thing we've come across is just being extremely innovative from the ground up, and including, I guess, political leaders who care about these issues. You have to think about the audience you're speaking with, and I think the message that can go out more is not from public health, global health practitioners, is not you're doing the wrong thing, you're hurting people. Yes, they know this, they're doing it anyway. That doesn't seem to be enough. But how this research, how these programs really affect basically health in the US, in these other countries as well. This is global. This is not a big planet. It is not really that big a planet. And so everything that's not being done for malaria, locally acquired malaria is kind of showing up in Florida. Meningitis, HIV, monkeypox, or whatever, mpox rather. There are a lot of getting the message out that this global health, an understanding of what's happening in global health, and controlling these diseases is only in the end going to help elsewhere. Some of the innovations that are happening in Africa can be applied here. Brian can maybe talk a little about sickle cell treatments. And then on the local level, one group we're talking about now in terms of women with cervical cancer and breast cancer, well, there's a big donor fatigue issue going on. I think Ron, referred to that. Where donor dollars are going to go is this one small hospice we talked to that's doing social enterprise, which has been around for a while. But basically, they're finding ways to earn money locally by renting out their medical equipment, or they have these nurses that can then be hired privately sometimes. So they've shifted their international contribution from 70-30 to about 55 or 58 locally, and the rest international. So they've been shifting this over time. So these are some of the solutions that I see both in communication and in what we can do as individuals. And one individual can do a lot of harm, as we know, in the world and over time and in history. One individual can do a lot of good. Usually it's more locally oriented at first, but then it can expand from there. And so that's kind of some thoughts I have on that.
Awesome. Great. Molly, any solutions you're looking forward to in the future?
I think just to build on what GHOane just said, I think really the importance of really clearly and effectively communicating that global health is local health and local health is global health. I think, even today there are people who are, extremely well-informed, who ask me questions like, why would you go halfway around the world to look at a health issue when we have health issues happening in our own backyard? And why would people, still there's a bit of a knowledge gap, I think, as to sort of why it matters. And it's clear to us, people who work in this arena, but I think actually, and Ridwan knows this well, but a epidemiologist I spoke to and across said, the mosquito. I think GHOne, you just mentioned this, but a mosquito can get on a plane, and as we saw with COVID, I think COVID was a really it was a wake-up call that we're one world and that one pandemic, we're one step away from everything shutting down, the economy, the health, everybody. So I think again, like I look forward to more communication going forward. I mean, unfortunately, we've had this is a really unfortunate circumstance that we're in right now, but there will be positive outcomes from it. There will be innovations, acts of resilience. And so I think it'll be really important going forward to demonstrate how those impact us like globally, not just locally.
Yeah, yeah, absolutely. No, and just talking about sort of that global to local, Joanne mentioned the sickle cell research that we're doing an article on, and we found, we came across this one sort of plan strategy that a Ugandan physician scientist working in the United States and at Texas Children's Hospital has been advocating and piloting, and that's trying to move sickle cell disease care down from sort of the tertiary hospitals where very few people have access, and so many young children really are dying without even knowing that they have sickle cell disease. And he's piloting a project to take this down, and have sickle cell disease be diagnosed, treated within sort of like primary care clinics. So vastly expanded. A lot of the diagnostics, the treatment and care for sickle cell disease are not that complex and can be done. But it's part of it is that the some of the treatments and stuff were set up in Western countries and developed countries, and so the assumption was like, oh, okay, yeah, this is complicated stuff, and so we want to make sure and have it as in the tertiary care setting because that's how it's done in the U.S. or whatever. And so then talking with other experts too to learn that it's like, wow, the U.S. could be looking at this as well because there's a shortage of benign hematologists out there who can see all these patients and all that too. So that global to local connection obviously is definitely a possible connection there. So I want to go to turn it back to you, Mikaela, if you want to share some of the common themes that have popped up in poll number 2.
Yeah, I think this is a lot of what you all have been discussing, but these are kind of the top three ones that were showing up in everyone's responses. First and foremost was unnecessary and preventable loss of life from cuts and decreased research, all of the different programs that are being eliminated. Number two was generally just systemic uncertainty and decreased trust from both the public and also policymakers, and even from health workers themselves, just the historical distrust between countries and between support and things like that. One person also shared miscommunication and undercommunication of the risks in particular. Number three was loss of health workforce and training, and then also the knowledge base. So that interrupted momentum in research and reversal of scientific progress, things that might be being lost in both research and among the workforce themselves through all of these cuts. And then a couple just overall themes of like specific topics were surges in HIV infection and access to family planning, increased preventable diseases, vaccine skepticism and rejection, and mental health overall. So all of those were shared by multiple people, and I think those are all things that you all have mentioned. But yeah, those are some of our key takeaways from everyone. So thanks so much for completing that.
Oh, thanks everybody. Yeah, and thank you, Mikaela, for sorting through all of those responses. I think the first two, could possibly have been predicted, but that loss of health workforce and knowledge, I think that's probably one of the most underrated impacts of the cuts too, for something to think about. And so, as we're talking about cuts, I'm going to start our next poll here. This is labeled poll number 2, but it's actually number 3. But I can keep up with that. So here's the question. Where will global health funding come from in the future? And interested to hear your take on this. So if you can, please take a few seconds here and give us a quick response on it. and then we'll be moving on to your questions. So we'll head to audience questions here in just a moment. And I know, Mikaela, you're sorting through those as we speak, right? Busy all the time. Great to see the responses here. Please go ahead and respond. This is going to be an easy multiple choice here for you. And again, it is all anonymous too, so say whatever you feel. We'll give it just a few more seconds here. Okay, I'm going to give it about 5 more seconds here.
And I just wanted to say while you're waiting, there are a lot of great links and resources in the chat that people are sharing. If you get a chance to look through, and people from all over the world doing documentaries and Think Global Health and Lancet articles. I put in the SBJ Code of Ethics for Journalists, so take a peek there at any time.
Awesome. All right, thanks, Joanne. All right, I'm going to go ahead and shut us down here and share the results. Interesting to see. So there's a lot of things are trending toward actually number one, philanthropic organization, 75%. I think a lot of us are hoping Bill Gates is going to leap into the void there, but maybe there's not even enough money in Bill Gates's wallet to cover things. But a lot of people are turning that direction. Interesting, 62% saying each country funding their own needs. And then another social enterprise. I think that's another one that's like sort of not thought about enough. It's certainly in sort of the layperson's context. So it looks like that was a big one. And developed countries still, we've got about 28% of folks saying developed countries as well too. So thank you for your feedback on that poll, and we will go right on into the audience Q&A. And so I'm going to be relaying some of the questions that Mikaela has triaged here, and let's get started. Okay. And so this we've kind of touched on this before a little bit, Molly. I think you did, but what are African countries doing to support their own people with AIDS resources and care rather than relying on U.S. funds? Who would like to take that one? Molly, did you just
I think we don't know yet. I think there was varied responses from, the governments of countries across the continent. Some, leaders of countries said, good riddance, goodbye. We don't need America. Some said, we need to step up and pledge more, and we can do it on our own. Some said, this is going to be terrible. And so I think there's a lot of uncertainty still. I think this is still so new that we really don't know. I think it's certainly incumbent upon a lot of countries, certainly on the continent of Africa, to step up and fund more. And I think there are countries that have for a long time, governments have said, for example, in Nigeria, we're going to fund more where the disease burden is massive, and they really haven't. So I think it remains to be seen, and it'll be a lot of, I think, pressure internally. If that pressure is there, then I think in some ways, our poll is right, and that, the governments will have to step up, and they will end up being the ultimate funders. But I think it's too soon to say.
Ridwan, did you want to weigh in on that one?
Yeah, I think I have already talked about the Abuja Declaration. That is what I think the countries need to go back, and enhance their commitment to that declaration. But I think that countries have also been doing their own assessment. I think some are still trying to figure out the scale of the problem, and so we don't have a sense of what a lot of countries are doing to fill the gap. But I think there are a few countries. So, for instance, in my home country, Ghana, the government is looking at how can technology, be integrated into the country's responses to a lot of these, health issues to be able to manage, the gap. The government is also looking at ways of developing innovative healthcare financing, mechanisms to be able to address the issue. But it looks like it's all up in the air until maybe by the end of the year we get a proper sense of what each country is doing.
Mhm. Mhm. Great. Yeah, definitely a challenge. Joanne, did you want to add anything?
I think, that being said, I think one thing we ran in we had a big dinner with a lot of top researchers in Uganda, set up by a colleague, and it was just an open chat about everything going on, and just these are people who are working on lenacapavir, people who are working just really, really all in researchers, and they're seeking uh, support elsewhere from other countries, even though other countries are cutting back. They're coming up with innovative projects that are unusual, that haven't been done before, that have clear, possible, practical applications. Everybody's sort of looking at, is this basic science now, or are we talking about something that will really possibly make a difference? But one thing I wanted to point out was they also talked to us about they could give us tips on authoritarian leadership. Let's put it that way. And they talked about how there was an edict that came down from the U.S. president, and then their president or the Ministry of Health comes out with an edict that says, "Okay, you're all going to go integrated," and then everybody has to do that. So insights from other countries that have gone through this. Latin America is another area that's struggled with health issues and how they do it. Just a lot of communication at conferences can really help, I think, understand how this work can continue to be funded,
Great.
government or otherwise.
Yeah, great. Thank you. This is we're changing the sort of our approach here with this question. This is from I'm assuming from a journalist who says asks if the panelists have suggestions for writers to pursue compelling, timely stories on this topic of global health now that these cuts may be considered old news in this extremely turbulent political landscape. So anybody want to take on that? Share your secrets for finding a fresh take on what may be old news. Joanne was waving her hand.
Yeah, I was just typing an answer to that, and Morgan's one of my former students, so I know her from that. I think the answer get posted. I can't tell from this. Well, I want to just give a pitch right now to the Pulitzer Center. They have a whole, focus on global health. They do care about these issues beyond the initial. There's funding for journalists if you have a project. I'm not in charge of funding. I'm not on any sort of panel or anything, but this is an amazing nonprofit, committed, one of the bravest I know organizations right now in journalism, and global health is important to them. And so that is one place I would think to look to, and particularly doable grant projects in the U.S., projects abroad that where there's a story. And so that's one thing I was going to say. Brian, what about you? You edit a publication that's focused on this.
Yeah, definitely a huge challenge. And I think, like we've heard this a lot, in this conversation is communication and is getting the word out there, getting the news out there. And so I just kind of turning it back to all of our attendees, how important it is to reach out and to speak with journalists as well too. So we're going to be coming up to that section of the panel
Sorry.
very shortly. Ridwan, sorry.
Yeah, I just wanted to, we can't stop talking about the cats because even the impacts have not kicked in yet. I think we are yet to see the worst, and it hasn't happened yet. So we can't stop talking about it. But I also think that we can bring some innovation into the coverage. So, for instance, how are communities responding? And when I say how are communities responding, are there community-led initiatives, whether small ways of trying to fill the gap? Are there any things that the African governments are doing to address the gap? let's try and get a sense of the community solutions to exactly what is going on. I also think, and this might not get popular support, but I think there are US citizens in a lot of these countries. In Ghana, we have, I mean, since we launched the Year of Return in 2019, we have over 1,500 US, I mean, African Americans who are living in Ghana. And they are impacted by these issues, so we need to also hear their perspectives, and just to also let the world know that there are people living everywhere, and so some of these issues affect them. And these people still have contacts with their families back in the US, and just to emphasize the saying that diseases don't respect borders.
Right, absolutely. This one actually is a little bit of a reflection on the first question, but it's a little bit of a different take on it. And this is what can developed countries do? Sorry, I just lost my place here. What can developed countries do to help enable and empower developing countries to support their own for these health issues rather than creating dependence on other countries? So, slight shift in that. Any thoughts on that? I mean, I can say one thing is that so many of the scientists and physicians that we spoke with in Uganda had actually been trained in the U.S. and had been trained through PEPFAR funding, and so that was one way of creating this like truly incredible knowledge base of really deeply educated, super smart, effective scientists. And so that investing in the human talent and the human resources definitely sort of pays forward. So that's one solution. But I'll turn to you, panel, if you have any other ideas on that. What else should developed countries be doing to empower developing countries?
I mean, I think maybe I'm just sort of speaking again, and I'm not in any sort of policy making arena, but speaking from a journalist perspective, I think it's important to, in telling stories and communicating these stories of the impacts, to not to approach subjects in communities that have been impacted as victims. Oftentimes I find, people talk about um, entire regions of the world as one place, like particularly Africa, it's just like it's one country or something. And everybody there is some kind of, why do they need to rely on these US programs? And I think that that's really, it's not only just completely untrue, but it's really devaluing and underestimating people's ability and resources and resilience all over the world to respond to these kind of crises on their own. I mean, we have been a very generous country, but I have no doubt but that people all over the world and all over the continent of Africa will rise to the challenge in some way because they're some of the most resilient, strongest, smartest people, I've encountered. So I think again, it's important it's very easy for us right now because there's so many fires, if you will, immediate fires. And there will be many more, unfortunately, to come. It's sort of a question of what will hit first, a pandemic or an epidemic, something that crosses borders, a new strain of malaria, a rise in HIV, whatever it will be, everybody will be racing to tell that story. But I think it is very important going forward to see that dependence as something that isn't, necessary. It's just been born out of this relationship that we've had for decades.
Yeah, yeah,
And
exactly.
just to say that I really appreciate you highlighting this. Thank you.
Mhm. Yes. And actually, Joanne, do you have a quick comment?
Yeah, and I think this is on point or off point. I think there's a call to journalists to show the impacts of these decisions also in the US. If we can track like the diseases that are showing up in the US that aren't being addressed anymore, to keep an eye on that, because in the end, that is going to make the difference. Unfortunately, in this particular environment, it doesn't mean that we won't become more global again, but just to keep track of like how can we have people pay attention, the stories and if you're in advocacy, we're not in advocacy per se. We're not in advocacy, but if you're in advocacy, we're seeking truth and we're trying to tell stories. But those who are, or those who are working with policymakers and elected officials, I know they're already doing this, but spending time on working with people who happen to be more bipartisan, who might see, what you're saying, whose ear you plant a seed. I think in the end, there are going to be enough people suffering even here that there will be more interest, and we have to have hope in that, I think. But just to keep seeking truth, to not let AI tell us what we're supposed to think and do summaries that are inaccurate where you can't find the actual answer in the link that AI just put up there. To not give up on any of this is would be my call to action on a lot of these fronts.
Okay, great. All right. Well, thank you, panelists. Thanks for exploring all of those topics. We're going to move on now to the communications section here. And I'm going to start off with this poll for our attendees. And here we go. Okay, so this question is for you. How do you feel about talking with journalists? So we're going to have a meeting of the minds here. Let's see. And your options are confident, okay, queasy, reluctant, or total fear. So if you can, please quickly register your feelings about talking with journalists. We'll give you about 5 more seconds here. And then we're going to jump into a discussion with our panelists about communicating science, how to do science communications, and also to how you could work with journalists. Okay, we've still got another few folks dropping in. Okay,
I thought Brian should add utter panic or something even higher level than
total
total fear is
utter
pretty
panic.
way up there though.
Dread, abject terror.
Abject terror. Oh yeah, that was it. Abject terror.
All right, here we go. I'm going to go ahead and stop the poll now and take a look at this. Okay, how about that? 22% feel confident dealing with journalists. That's awesome. Great place to be. Okay, we got 41% there. We got 12% queasy and fully 24%. A quarter of our attendees are reluctant to speak with journalists. Okay. All right. We didn't register any total fear, but if you're reluctant, we're going to work really hard in this next session to raise you up to queasy. Okay. Thanks so much. Okay. All right. So let's jump right in for our questions for our panel. So here's a basic one. Why should scientists talk to journalists? What's your thoughts on that? What's your pitch on why they should talk to you?
Because we are partners in development. The work of the scientist will not be known by the world. The people that really need to know about, the work of the scientist, if the journalists are not there to tell the story. And I also think that it is the responsibility of the scientist to get the communication right, and it is the responsibility of the journalist to get the science right. And I think that that sort of marriage hasn't worked really well over the years because you're talking to scientists and they are not speaking in the language that the journalists understand. And when that happens, then there is that latent danger of the journalists going and misinforming everybody. But when we recognize that the scientists need to get the communication right and the journalists need to get the science right, then each party understands the responsibility that they carry in this marriage. So looking at it, in that sort of lens would really work.
Fantastic, Ridwan. I really love that. Absolutely. Scientists have to get the communication right. Journalists have to get the science right. Absolutely. That's a great, yeah, we should have that on a t-shirt. Awesome. All right. Other thoughts on that? Why should scientists take the time to talk with journalists?
I think I would, I mean, I think actually, well, I'm going to have to get political here in just one way, and that I hope the majority of people on this chat and this group believe in the power of vaccines. And I think that that's a really good example right now of why The situation with vaccines, the messaging in our country right now, has really, unfortunately, done a lot of damage globally. There was already vaccine hesitancy in a lot of countries around the world, whether it be for, religious reasons, for traditions, whatever it may be, or very real, rooted in very real fears about what Western science or medicine or aid has done or not done for local communities or from communities around the world. But I think if you look at, for example, the messaging that has been put out surrounding vaccines and the danger of having very powerful people be able to walk out onto the world stage and communicate that kind of misinformation, you really see there the exact consequences of what happens when we don't have enough scientists talking to journalists and journalists talking to scientists and sharing and telling stories that can convey to people in very clear and fact-based ways why vaccines are so effective at preventing death and disease. I think, if you want a real world example, look no further than that. That's what I would say.
Absolutely. Yeah. GHOne.
Yes, I think scientists out there can keep an open mind that there are journalists that they can work with. I'm not saying every journalist is gonna work great with you, especially someone just popping in or parachuting in. However, you can look back at their work. You can see what they've written before. If I'm a journalist reaching out, I'm affiliated with I teach at a university, so that already shows that I have some awareness of academics or science. I teach in a science writing program. Those things help. But if you're not affiliated in that way, I wouldn't say the Miami Herald would always get me talking to a scientist. They're not going to trust how the Miami Herald is going to take things, but kind of what I've been doing in recent years. Yes, I'm not there anymore. Is in your if you're a journalist and scientists can look for this, the journalist should be researching your work when they reach out to you. They should be mentioning a study that you've done, why they're reaching out to you. They don't just want to quote. They see the value of your work in this. So if you're a journalist, you should be doing deep research on whoever you're speaking with. It doesn't take more than a day or so, and show that you have interest in what they're doing, and that you're talking about something that maybe they're interested in talking about, right? A lot of scientists want to talk about something that matters to them. So that kind of respect and communication, like respect between both parties, I think would really help to speak with journalists. And then, we both, Brian and I both way up front say we're going to fact check anything that goes in. I fact check the heck out of everything I ever do. I check every word. I check, is it a the or is it an I mean, I'm so concerned about getting things wrong that I double check. How do I know this? I use, primary sources. I use research studies themselves, but just journalists that are doing this kind of work are usually very educated in the issues of science. Not as much as a scientist will be, and maybe not in that topic area, but they will come to the story with a depth of commitment that I think you can look for when you want to speak with a journalist.
Mm. Great. All right, great. Thank you. Yeah, so there's this connection between the scientists, and when I'm saying scientists, I'm also meaning public health practitioners, public health leaders. I'm kind of just using scientists as a quick kind of collective term there. But one thing too, I think is so important, and we talked about this a little bit yesterday, is getting the rules of the game in reporting down, so that the experts being interviewed know exactly what terms like off the record and on background mean. And GHOne, you talked about that just briefly before, but could you give us sort of just the highlight, like the quick definition of those two terms, because they can cause problems?
Yeah, and others can jump in. And I did put in to the chat SPJ, the Society for Professional Journalists Code of Ethics, which lays this out. So you can even just look that up and see it. But essentially, the way I work, and there's some nuances here, is I'll say, if someone starts to say, I want to go off the record for this, I'll say, well, can we go on background? This means I won't quote you, but the information might be, useful for me to use in some way. And then they're like, okay, that's okay. So people throw around off the record because it sounds like a journalistic term, but that locks down the journalist where officially where you're not supposed to even use the material that is said anywhere. What they really are worried about, like I'd mentioned, was I don't want to be quoted. Okay, so you respect that. And those are the two main things. There's on background, there's on deep background, there's not for quotation. There are a number of things, but basically on background is the easiest way, I think, to be comfortable. And then you have to make sure you go back on the record because officially you're still on background until you do that differently. Up front, I always ask it with the person being recorded, is it okay if I record? I'm in a dual permission, whatever the phrase is, state. So you can't record someone without their permission. So I always record, and I always say I'm recording this for accuracy because I want to get everything right. Because sometimes if you ask people, can I record? They're like, oh, what are you going to do with this? So it really is for that. And those are the two things I do, but you can get more details. And it's all about trust and transparency and accuracy, as accurate as we can get. That's what I feel.
Absolutely. I think one challenge that we run into during interviews is when a source will tell you something and then say, "Oh, that was off the record."
Yeah.
It doesn't really work that way, right? So you want to agree on what's on the record and what's off the record before anything happens.
And if they say that, you could say, you come back to it later and say, I mean, I can't really be off the record, but what's your concern there? Or you kind of have a conversation.
Great.
Nothing shows up in a story I write that they don't know is going to be in there. So even at that last moment, I'm not going to give them back out, but at the same time, they're not going to be surprised.
Great. Okay, so here's a question for you from the perspective of our audience. So if you're a new researcher, if you're a researcher with new findings coming out, how can you capture a journalist's attention? Who would like to take that one? You guys can do this. What are you looking for? All right, Molly.
I would just say, like, I'm always looking for ideas sort of everywhere. So I think it is important to have, a presence on some social media, whatever your preferred, outlet is. Um, I'm always sort of scouring and following, various accounts of scientists and health leaders and, that kind of thing. I think that's a really good way to get news out. Um, it's not really unlike the sort of the really old days, and I'm dating myself, but at a newspaper where like the press release would come through. It's just different ways of doing it. And I think I would never hesitate to just send an email to a journalist and say, given your work, I think you might be interested in this. I think that's, totally acceptable and fine, especially in a universe where, if you work as a freelancer like I do, you don't necessarily have someone coming to you all the time saying, because this is your beat or, contact that person at that organization. So I'm always looking for stories. And if it's not something that I'm qualified to cover or I can't, I'll tell you, but I personally have no issues with that. So I think that's always a great approach too.
Great. All right. So here's a question. How is reporting different in TV, radio, print, web? What should scientists know? And I saw Ridwan has a big reaction to this one. Do you want to start off?
Uh, That's an interesting question. I think people should know that these are like different, apart from how they appear physically, these are different formats. Um, in television and radio, you need to be very crisp, with your writing. You need to be very efficient with your writing. I know, like, print gives you a lot of room, to elaborate, insert links about somebody that you are quoting or stuff like that. But in radio and television, a lot of the time you cannot do that, So, and a lot of the time too, you have a limit for the story. So you are supposed to do a very well-rounded story, but you have 4 minutes. So how do you make sure that you get all the important pieces into the story? So it's different. And sometimes you talk to scientists, and after an 60 minutes of interviewing, they see the final piece and they get like 10 or 20 seconds, and they're like, "So I wasted my time talking to you, and you only gave me 20 seconds or 10 seconds." But they don't understand that, it's even like a challenge for us journalists trying to get the dense information into like a 2 minutes or 3 minutes or 4 minutes piece. So yeah, that's what I would say.
Mhm. Great. Any other perspectives on working in different channels, Joanne?
Well, our two pieces ran on NPR Online, so they're not radio. They are print, and there are two issues I think here. One is what you can do in print, and obviously in video or TV or cable, is visuals. Visuals can tell a lot of the story, and you paint visuals with your words, which you do in radio. And we also, and as a writer, I've written for a while too, and I even had like a 2014 copy of Smithsonian that I stuck somewhere. It tells you kind of the chaos in our house. And then read one recently. I'm like, oh my gosh, the stories are so much shorter now. Yeah, I could see this really long story. And then one of them, like, this long story is so great. What happened to the Smithsonian? And then in this other long story, I'm like, oh, this is boring. So our stories have gotten shorter and shorter. And I spent a lot of my time. Every word has to count. Francine Prose once wrote, put every word on trial for its life. Right? And that's kind of where it has to be. So you have to get all this information and make it active and make it engaging in shorter and shorter spaces. And that's kind of the trend anyway. I'm not talking a soundbite short, but these are not 4,000 word stories anymore by any means.
Mhm. Great. Speaking of visuals, I'm going to shift over to one of our audience members' questions here. In terms of visuals, how do you protect sources' dignity and respect with visuals? So either video or images.
I think that's a great question. I think that, there are just sort of we have as journalists rules about, not, for example, adhering to HIPAA rules, not showing a patient without in their identity without, confirming with them that they are agreeing to do so. I mean, those kind of things are just sort of, if you're working with a good journalist, they're kind of common sense. We don't put like children's faces on or interviews without their consent, without parental consent. So there are a lot of things that we certainly do. Like if I'm working, for example, for PBS, there are standards for news that are adhered to. And then I think they're just the rest is also just very, I think decisions that you make on the ground when you're talking to people to respect their privacy during really difficult situations, to make sure that you don't just kind of barrel into a community and grab someone for an interview and walk away. I mean, you have to earn people's trust and you have to do so in a way that's honest. And I think that often takes time and it means sometimes explaining to people the consequences, as much as we might want to just go in, get this great interview and leave, sometimes for people who don't, for example, understand what a US television audience looks like, saying, are you sure that you're okay with doing this? Because this will reach, potentially millions of people in the United States. So yeah, I think that there are, in some ways you're taking a leap of faith and working with a journalist that you don't know. But if you have any concerns, I would always ask them, how will you handle patients here? Or how will you handle people who are in vulnerable situations? And it's just extremely important to hear, the words trust and respect in these kind of situations. And again, not victimizing people, listening to their stories, and taking the time to do it right.
Mhm. Mhm.
Just to piggyback on that and say that it's also not always about consent because people have different exposures. So somebody might not be able to tell that, okay, allowing you to show this is dehumanizing. So it's also an issue about discretion, like you, the journalist, that even though this person has given me the permission, but I also recognize that this is not TV worthy, and so I won't put it on TV. Yeah.
Yeah, we spent a good bit of time in clinics and hospital setting, and we made sure we had they were getting written permission. The people we were, the program directors. So we make sure we got copies of those. And there's one in which I'm shooting, and it's all happening in front of me. Like the mother is breaking down with the doctor. She has children with sickle cell. Um, the doctor, and she's crying. So I shoot a couple images of the crying, but there's one image where she's no longer crying, and she's got her head on the shoulder of the doctor, and it's a beautiful picture. I'm not going to use the crying picture. I'm not. Maybe some journalists would, but to me, it's not as respectful of the one where there's a communication between these people, and everyone in it is Ugandan too. It's not like a power, dynamic, and and that's the photo I would use. So I choose, and and then Brian did a number of portraits, all of which are you want to be flattering, you want a portrait to make the person look not bad. I mean, they're trusting you with their image, and Brian's portraits are gorgeous. I think everyone looks like there's a lot of respect in that photo, and in the way they're standing, and just there's that. So there's some sensitivity, because and then you make sure they know what you're doing and where it's going to be and all of that.
Yeah. Yeah, it's capturing reality with respect. I mean, I think that seems like what I've been hearing here. Yeah, absolutely. Um, so let's see. I've got another question here. Uh, how do you communicate about issues that have been polarized? Because different, issues have been taken in, especially in the U.S. as of late, and become like flashpoints for, all sorts of disagreement and everything, so many things about health have become politicized. How do you approach stories that touch, in that area, whether they're abortion, gun violence, any of these issues?
I mean,
Molly?
I guess I would say you stick to the facts. I mean, that our job is not to weigh in on, these things in terms of our own ethics or morals or political beliefs. This is fact-based, and if you're sticking to the facts and adhering to the facts and checking your facts and triple checking your facts, then yeah, I think that's what I would say.
Mhm.
I also think that the approach should be more forward-looking, not a bunch of personalities debating and disagreeing with each other. Sometimes even the questions we ask are the questions forward-looking. Are we seeking to have like a heated debate in a story, or we are looking for solutions? So it's just reimagining the way we cover some of these issues. I'll just say that.
Mhm.
And the most controversial issue, I guess, that would be tackled mostly would be the prostitution element. And we we painted the human face on the story. It's not quite the way to put it. We told a human story. We put a human face by telling a human story that where empathy can no matter what your opinion, this is still a young woman, and there's got to be empathy. And so we tell her story in a way. At the same time, she did not want to be identified. We do not have a photo of her. And we had to talk to the editor about what to do that. We just said for privacy, and that wasn't good enough for not using names. So we said because prostitution is illegal, and then that's why we don't name. Because you want to name your sources, so because you're talking to real people, especially when you're working out of the country, you want to use real names. But in this case, that's how we were able to touch on a controversial issue, paint the story of a human being who was suffering, and at the same time protect her privacy.
Mhm. Great. All right, we're getting down to one of the last questions here. How do you reach a wider audience How do you reach beyond the choir and reach and connect with people who may not be sympathetic to what you're writing about?
I think it's about humanizing the story, and I think now we are doing a fantastic job with that. Previously, you would just hear the technocrats and just a scientist talking, but being able to go to the communities and meet real people who are affected by these issues and just connecting the dots, will make the story more relatable. I also think that there are so many people that we are leaving behind. When you consider the population of persons living with disability in the world, that is close to the population of Africa. But you look at a lot of media programming and content, a lot of persons living with disabilities are left behind. How do we, present these, content in a way that it's inclusive? I think it's also something that we've left out of the conversation for the longest time. Maybe we need to, look at that. So for me, it's about humanizing it because once you humanize it, it's close to home and people can relate and they can connect.
Great. Great. All right. Molly, go ahead.
Oops. Yeah, I was I would say the exact same thing. It's really, really important to tell human stories. And, if you go and you tell a story well, that is, it's not your story, it's the story of the people that you're going to tell. And if you do it well and do it effectively, then, that's really the best you can do. If people don't feel if they don't feel moved by it, then there's certain people you're just not going to be able to. I think you have to start with the assumption there are certain people you may never be able to reach, and I wish I could say differently, but in this environment I think it's really tough because I think a lot of people have just unfortunately chosen only one outlet for news, and so it's difficult to reach people from all different walks of life and all different points of view and all different political um, spectrums, but we just have to do our best, keep telling the stories, do them well, and hope that you break through to someone. And I always say if you get one more person to listen to your story who may never have thought, oh, I'd be interested in that or that would matter to me, then you've succeeded.
And just to also add quickly that now I know there's a lot of fascination about social media and fighting dis and misinformation online, but there is a lot that is falling through the cracks offline. There are so many communities, particularly in the global south, where people don't have access to the internet, they don't have access to electricity. What that means is that they are relying on radio to access critical information. But what we are also realizing is that storytelling on radio, particularly in the global south, is dying. We are just hearing a lot of talk radio. So let's get back to getting more stories on radio, particularly for those in the hard to reach areas.
And I want to add one last thing that a number of the people we talked to, the number of people I ended up talking to, especially were mothers. And everybody has a mother. So when you tell the story of a mom who's struggling to take care of her kids, that is a touchstone that is very moving for a lot of people. And it just happened that way. And mothers, in many ways, as one person said, the mother is everything, in terms of keeping kids in education, keeping kids fed, keeping kids, they're the cornerstone. So that to me ended up being a universal story that everyone can identify with because everyone has a mom.
Great. Well, I think this is a great place to wrap up, but I do have one last question for Ridwan. Ridwan, you're in the U.S. now on a very prestigious fellowship. I'm just curious, what do you see that news consumers in the U.S. are not getting? What are they missing out on in what we hear every day here?
Oh, wow. That's an interesting question. I think people are, and I know and I understand that there's a lot happening in the US, but I just think that the perspectives that I expressed here are just about the US. Meanwhile, the world is very big. And so you attend this function and, the topic is either about polarization or it's about the state of US media. But the thing is that the countries that are around the US affects how the US functions as well. And so I think that we need to get a lot more global perspectives into discussions because I think there's just too much concentration on US perspectives. And I think it also doesn't help because I mean, there is no belaboring the fact that we are more globalized now. And so I think we need to get a lot of different perspectives into discussions. And that's why I'm also happy that through my work with the world, I'm able to get some of these stories from the continent to audiences in the US so that they know that, some of these issues affect everybody and not just, people in Africa.
Awesome. Well, with that, thank you, Ridwan. Thank you, Molly. Thank you, GHOne. And I'm going to turn it back over to Mikaela.
And thank you, Brian. Thank you so much for leading this conversation. That was wonderful. I wanted to just highlight in the chat real quick that I shared a document. There's both a Google document and a version you can download with a lot of the resources and links that we talked about today, including to Pulitzer Center reporting, to Global Health Now, the outlet that Brian runs, as well as some other resources for science communications, plus links to all of their amazing reporting and some of our other grantees reporting on foreign aid cuts. Also, on the second page of that is this exercise that we did not have time to get to because we wanted to focus on the conversation and we figured you all could work on this asynchronously. So, wanted to give this with you to take away. But these are just some helpful framing questions to be thinking about how you can really distill down what the story is behind some of the research and work that you're doing. So, if you are thinking about how you could be pitching this to a journalist or pitching it to write an op-ed or something like that, these are just some great questions to get you thinking about what's happening, who your subject is, and most importantly, why should your readers care? What are the things that they need to know? What are things they might need broken down? Any of those things. So definitely take a look at all of those links. All of these panelists, great reporting, are wonderful examples of strong science communications. Yeah,
And
GHOne.
I wanted to add something really quickly. I'm going to put in the chat. The program I teach in is a master's degree and graduate degree in science writing. So if any students, any young writers out there are interested, and we focus on a lot of these issues and how to do really good science and health writing, I'm going to put the link in the chat. I teach in the program. So you can see some of these questions that are answered in our courses. So it's kind of cool.
Thank you, GHOne. And Molly, did I also see you raise your hand?
Oh, no, I was just
Okay.
typing a thank you in the chat.
Okay, amazing. Well, thank you.
Yeah.
And yeah, I just wanted to plug finally, there'll be a brief survey when this session ends. So if you could just take a second to share your thoughts, any feedback. So thank you again for joining us. Thank you all to our panelists and for everyone for all your great engagement with our polls and in the chat and with your questions.